All right. Welcome, everyone. Once again, my name is Courtney. Excited to have you all here. Before we get started, I would just like to acknowledge that I'm coming to you today from the unceded territories of Sauk Nation on Vancouver Island. And it's important to me to acknowledge our territory as well, and also recognize that the work of BC and PHA happens across the lands of over 199 distinct First Nations communities in the province of BC. Please let us know where you're coming from as well in the chat. Say hi. Let us ground ourselves in the space. If you have any questions today for any of our presenters, you're welcome to raise your hand, unmute, and ask. If you don't have a mic or you don't feel comfortable asking, you can also type them in the chat and I can ask the presenters as well. And then we'll also just have some free question time at the end if you would prefer to ask it as well at that time. Awesome. And if you have any other tech concerns, please feel to send me a message as well, and I will do my very best to assist you. But to get us started, I'll pass the mic over to Shruti.
Good afternoon, everyone. My name is Shruti, and I'm a policy analyst with the BC Nonprofit Housing Association. Before we get started with today's presentation by Lifeguard, I just wanted to give you a bit of an overview of what this funding program is. So essentially, BC Housing provided funds to BC and PHA to give out supportive nonprofit housing providers with funds to buy overdose prevention technology. For now, we know that the fund will be released in January 2024. So all supportive housing providers who have tenants at risk of overdose from substance use are eligible to apply for the funding. For those of you who do not have an operating agreement with BC Housing, there's going to be a bit of a different process on how the funds are going to be allocated, but we encourage everyone who has a need for the technology to really apply for this funding program. As for the way the fund is going to be distributed is entirely going to be dependent on the uptake of the funding from the sector. You can apply for how many ever units that you need for, but the funding is only so much. So we would be giving it out based on where the need is highest and obviously try and get it out to as many providers as we can across the province. We will email you more details about the fund along with the application and everything that you need to know in January 2024, and definitely going to be more communications coming out of it. If any of you are joining us at the Housing Central Conference, we'll have our overdose technology providers there as well, Lifeguard and Brave, and you'll be able to connect with them in person as well and ask any questions you may have about the program itself. I think that's it about the program. If you do have any questions, I'll just pop my email into the chat. Please feel free to reach out to me and I'd be happy to answer. I think it's now over to the Lifeguard team to get us started today.
Let's just get the screen out in here.
Sorry, just give me 1 second. Sorry, guys, just one technical difficulty.
There we go.
There we go.
Good.
All right, can everybody see my screen all right? Perfect, thank you.
Awesome. So welcome, everybody. We're so excited to have you here. This has, been a long time in the making, bringing, this technology, and to have all of us here together today to be able to share collaboratively and work towards saving a ton of lives I just feel so blessed and excited. So we're going to go through this presentation with you today. At any time during our presentation, if you have questions, this is meant to be collaborative. So if you have a question, raise your hand or speak up, whatever. We're all here working together. So anytime you have a question, just fire them at us. You don't have to be worried about interrupting. Okay. So today's agenda, we're going to do a team introduction quickly. Then we're going to go through our BC Emergency Health Services partnerships that Lifeguard has. We're going to talk a little bit about our background and the development of how we got to be here today. We're going to do a demo for you on the device and how it works. Then we're going to go through all of the cool marketing collateral and all of the things that we provide to you as a partner with us. We're going to go through a timeline, and then we're going to give you an example of the really cool customized reports that as a partner with us, you would be receiving on a monthly basis.
Go ahead, start with the introductions. Yeah.
Sure. So my name is Jamie Sinclair. I am the manager of supportive housing with Lifeguard Digital Health. My background, I have about 25 years of lived experience in addiction. The last 6 years, I have been working on, I started doing street outreach in the downtown east side. I've worked in shelters, and my 2 years prior to working with Lifeguard, I managed a very large supportive housing building in Vancouver. What brought me here is doing the 24-hour wellness checks and knocking on the door and not knowing what we're going to find, and far too often finding people who were deceased. This project is my passion.
Hi, my name is Amanda. I'm the project manager, and I'm also ongoing client support. I too come with lived experience and over 6 years experience in managing supportive housing buildings. And I joined because we are saving lives. And I've experienced the loss and the trauma and the grief of building connections with tenants and losing them.
Yeah.
And this is the solution. This is why I'm here.
My name's Alex McGovern. I am the Vice President of Engineering at Lifeguard. So I deal with the development side, working on any tech questions, making sure that we customize the system for your particular building or organization. And I've been with Lifeguard for just over a year now, and been working in the space for about 4 years in helping prevent opioid overdoses.
Thanks, Alex. Yeah, hello, everybody. My name is Jeff Hardy. I am the founder and chief executive officer of Lifeguard. It's been a long time to get to this point. We'll talk a little bit about the trials and how long we've been supporting this product and what we've done out there in the marketplace, not only currently, but when we started our first trial with this product back in 2018. I also wanted to just mention that one of our other colleagues is actually with you guys, calling in from our Australia office. That's Dr. Kanina. And I wanted just to, she may drop in terms of a couple of explanations of some of our privacy products that we have incorporated into this. So I think the next slide, or I guess slide or video, is one that we're extremely proud. BCHS or BC Ambulance was one of our first main partners. And as you'll hear in the slide, they have been extremely instrumental with us, not only here in BC, but across Canada. In Australia, they've helped us, as well as they've connected with us and for us into the United States. It was really the partnership that allowed us to gain the patent on our technology of the call from a smart device to a 911 dispatch, going through all the steps and the technical parts of being able to connect there. So I'm going to let Kevin Smith, who is the Chief Strategy Officer of BCHS, we'll play his video and get a little feedback from himself.
Hello, my name is Kevin Smith, Chief System and Strategy Officer for British Columbia Emergency Health Services. I would like to take a moment just to speak to you about our relationship with Lifeguard. As an emergency service provider responding in real time to 911 calls involving drug overdose, poisonings, it is having a devastating effect, and we see that firsthand on our people, communities, and the responders. As a response agency, typically, we have been reactive in responding to these 911 calls for help and dealing with trying to increase survivability. BCHS, working with Lifeguard, is interested in being more proactive in how we can decrease harm through harm prevention programs, injury reduction, and decrease mortality due to drug overdose and poisoning. Services and tools offered through Lifeguard, developed in cooperation and collaboration with British Columbia Emergency Health Services, are aimed to do just that. We look at this crisis that is happening not just within Vancouver, across the province, but really nationally and globally. And being an agency that can be involved to proactively address some of these situations within our community is a priority for British Columbia Emergency Health Services. And as a leader, I'm pleased to be able to work with Lifeguard. We look forward to collaborating and working with other partner organizations who are interested in increasing awareness and decreasing death and injury as a result of poisonings within our communities. And we look forward to working with you closely on that venture. On behalf of British Columbia Emergency Services and, of course, our friends at Lifeguard, thank you for allowing me to speak a few moments and present to you how we work closely with Lifeguard in this space. Have a great day.
So he can't hear us, but the spirit's there. Thanks, Kevin.
Okay.
So background and development. I noticed that ironically enough that our Phoenix friend is right underneath us today, and we see a picture, and I say that because very interesting plug for Phoenix here. First of all, 2 alumni. So I left Phoenix in 2017, and I just had my 7-year anniversary in October, clean and sober from alcohol. So thank you, Phoenix, for that. But also, next time you go on the 2nd floor, touch room 204, because this is exactly where Lifeguard was created. So I thank you for the opportunity there. And I know Amanda wanted to say something too, because she came from there.
Yeah, we were actually in Phoenix at the same time, so
Yes.
that connection is there, and I'm very happy to be part of this team. And my father went through Phoenix as well, so it's had a big impact on my life. And yeah, over 7 years sober for myself as well. So thank you.
Thanks, guys. So anyways, like, you kind of got the bit of the drift there. When I was in Phoenix in 2016, I got there, which was my 7th in rehab and was my last. And while I was there, which I was there for just over 2 years, and a good friend of mine passed away. His name was Evan. And I don't know if you guys can see or not, but on our banner here underneath our logo, everything is powered by Evan here, and we do everything in his spirit, and then everything is honored in his name. His mom and dad are part of the board here and a part of the influence of what we do. So it's very much built around his legacy. So while I was there, and after Evan passed away, I always like to make this point that I'm really not very technical, which is ironic that I started a tech company, but trust me, we have good technical people on staff. So how did I develop Lifeguard? It really was more of a picture and more of an idea I had in my head, where people who would be alone, how would we get them help? And most people have cell phones, and of course those that don't, that's why we're here today. But most people did and do. And how do you bring emergency services or help or people around people that have overdosed or in crisis? So we developed Lifeguard and the technology I spoke earlier about of how to get a message from a cell phone to a dispatch of emergency services by providing them the proper information to respond on a call directly where those people are. And that today, that technology saved 75 lives. In 2018, we were given the opportunity to start a trial. And I have to tell the story, because when we did this original trial, Princess Street, Portland housing building, we were given the opportunity to roll out in. BCHS had provided us 30 cell phones, and we loaded those with the Lifeguard app, gave them out. Day 2, we're at 25 phones. Day 3, I think we're at 20. Because we had them kind of on our network, we could tell where they were. I think one was in Calgary and one was in Toronto. So quickly we learned that the cell phone was not the best option for us to be given out in this environment. We went from there to even a worse decision. We decided to put Lifeguard onto a tablet and mount tablets on a wall. And we felt that the security in them, because they're mounted on the wall, was going to be in a position where they were secure, and that was not the case. We found and learned very early that they were getting ripped off the wall, getting sold again. But the real lessons that we learned through that whole trial, which was 2.5 years, we learned simpler, easier to use was the key. They did not need things like the ability to download Netflix or Prime or any other applications. What they needed was a device that had really what's turned out to be 3 very simple functions. They needed a device that really had low value, a device that wasn't attractive to be sold, and also with one that could withstand, a hard environment, people that are rough on it. We've all been there and understand. And Lifeguard Lite, so far to date, we have not had one that's been broken or call it trashed. So fingers crossed and touch wood. But it was built to withstand that kind of pressure and that kind of stress. After our trials, which really led into 2020, of course, we all know that COVID hit. And May of 2020, we were asked by the ministry to start to being prepared to roll out across the province with our Lifeguard app, which most of us are aware of. Our next Phoenix sort of plug is that your new Chief Executive Officer, Justine Pattison, was actually the person in the ministry who signed off and said, you guys, let's get this across the province. And we were originally scheduled to do each health authority, but then as death increased and the toxic drugs got worse, we rolled out, I think within a month. So 2020, 2021 became 2 years of understanding the marketplace, understanding people better, how people are responding to our technology. But at that time, we were still in trials with PHS on a smaller scale, but learning more and more about some of the better ways we can improve Lifeguard Lite. We developed the actual groundwork of how we're going to develop the hardware. And I think it was when did we get together with Odin? 2022. So in 2022, Alex and his team joined Lifeguard. Alex started a company called Odin, and we were extremely attracted to his company because it was a company that was designing hardware and algorithms that could do things like monitor vital signs, and we're working with different ways to find overdoses and overdose detection. So we acquired Odin last year, and that has been an unbelievable partnership. Alex now is, like you said, VP of Engineering and leads all of our hardware, which he's the key designer and really the smart genius behind Lifeguard Lite.
Yes.
So in 2021 again, we were awarded a contract through SUAP for 1,200 Lifeguard Lite devices rolled out across the Portland Housing Society fleet of buildings. And I can tell you now that that install has been, again, extremely a learning curve on many levels. How did we approach that many buildings with the ability to be able to do everything we do with the support, with the collateral, with being able to train. And in this presentation, you're going to hear a lot of we and us. There's very little you, meaning that we do not ask you guys to get the development or, of course, the installs, any of that stuff. We do all that, and we're going to get into that later. 2022, we were awarded 2 more SUAP grants, which helped in building this product, and more rollouts. We had more people this year and last year get on board with the Lifeguard Lite program. We currently are installing or have installed just under 2,000 units. We just got an agreement with a facility in Philadelphia, working with the state of New York and also New Jersey. So going past that and with our development, we are here, and we're going to talk and do some demos, and we're going to do some more discussions and Q&A. But I'm going to let Alex take over the next slide, and I think at this point we're going to give you guys a video of Lifeguard Lite.
Yeah, so this is just a quick 1.5-minute video that shows some of the basic functionality of Lifeguard Lite, and then after that we'll do a live demo as well. So I'll let the video speak for itself.
Lifeguard is proud to present Lifeguard Lite, a device designed for social housing. It operates on cellular technology and has an array of features. First of all, the use-alone timer. A resident will start the timer before they use substances. And they can extend the timer up to 6 minutes to give themselves extra time. Once they are done using, they can press the I am OK button to turn off the device. If the timer is not stopped, the alarm will sound to rouse the resident. If they do not stop the alarm, an alert will be sent to the staff's tablet. Staff will respond to the alert. The card indicates the room number and priority. In addition to getting the alert on the tablet, EMS can be alerted, and staff can also receive a text message. The device also has a built-in temperature monitor that reports the average temperature in residents' rooms every 15 minutes. In the event of the room overheating, staff is notified to check on the resident. We also provide a monthly report to help determine which rooms are too hot or too cold. The device has a built-in smoke detector sensor that monitors the sound of smoke detectors going off nearby. It can send an alert to the tablet, notifying staff to respond. Finally, in the event of an emergency, the staff can send an evacuation alert from the tablet to all devices in the building. A different alarm will sound. That will assist staff to evacuate the residents. A life-saving solution by Lifeguard Digital Health.
So I think we're going to go right into the live demo here.
Gotcha. Any questions so far? Okay, so we're gonna do the live demo. Some key things that are important to kind of mention with the device, and a lot of this comes to the training and the install. So when we come to the building, we spend a lot of time with each resident. We want to know, where do they use in their room? Where would this device go so that they don't even have to stand up? There's zero personal information that we collect when we install these. Something else that I think is really key is there's still shame that's associated for some people with their substance misuse. This device never alerts a staff member when they press start. So we're honoring their privacy, that when they're in their home and they press start, it's no one's business. We're not monitoring that. The only time staff is ever going to be alerted is if they're unconscious and they're not able to alert staff themselves. So what Alex and I are going to do is we've got this set up right now where we're going to start the device. We're going to show you what it looks like on the staff tablet. And we have it set up right now that it's actually going to call 911. So 911 is going to call us back. So this is the actual device. This is what it looks like. As Jeff mentioned, it's really hardy. It is hardy. And a lot of it has to do with the education. I've worked in this field for a long time. So it's there's nothing cool about this thing. There's no copper wiring here. If you rip it off the wall and try and sell it on the block, you're going to look ridiculous. Leave it on your wall. If you don't want to use it, you don't have to, just ignore it. So a resident is going to use a substance and they literally press start. So when you press start, it defaults to 1 minute. However, we know oftentimes 1 minute is not going to be long enough. If you're someone who uses intravenously, you're dope sick, you have the shake, you need longer than a minute. So when they hit the extend button here, each time you hit the plus, it gives you an extra minute. So you can go all the way up to 6 minutes. Once you're ready to go, you press start and it'll count down. Now for our purposes today, I'm going to restart it so you can see what happens when it counts down. So it was a focus group and it was actually residents who assigned the thumbs up, I'm okay button. So we're going to press start. It's going to count down from 1 minute. Now when it gets to the last 10 seconds, you're going to hear it's going to start to beep. It's intended to be annoying. The idea behind it is if someone's used a substance and they're on the nod, it's going to be annoying enough that it's going to rouse them and they're going to press the I'm okay button to make it stop. If they don't, that's when the alert's going to be sent. Now, during our trials, we found that we had quite a few false alarms because that 10 seconds just wasn't quite enough. And it was 2 or 3 seconds later that they were pressing it. So we've added a buffer of an additional 10 seconds. Nobody sort of knows it's there, but it's hidden. So from the time, so here's the beeping. So at this point, the tenant could still press I'm okay, and it'll just put it back to sleep. Now you're about to see what's going to happen at the staff tablet, as well as the staff cell phone. So on the screen, it's the room number. So it would be room, for this purpose, R5. We've also got an alert on the staff cell phone. So if they're doing rounds, they can see. So Alex, can you press respond? So when the staff press respond, it turns the alarm off, but it will not clear that alert. So when staff go to respond, they take this cell phone with them. I'm going to press I'm okay, just so we can stop the noise. When they take the staff cell phone with them, understand when the alert goes from here, it goes to the tablet and it simultaneously goes to 911 dispatch. Because we have this partnership, it goes to our own direct line. They know it's Lifeguard. So now when you have a staff member who is responding to an overdose, they don't have their cell phone, on their shoulder like this. They've got their crash kit. They're trying to do, we're trying to do crowd control. We're trying to assess the individual. Okay, they need naloxone. Now I'm trying to load it. They don't have to do any of this. They take the cell phone with them. 911 knows your building's address. It knows the unit number that the alert went off in, and it knows the staff's cell phone number to call you back. So 911 is going to call the staff member back and say, hey, we just got an alert from your building. Do you need us to attend? Yes or no? So you still have the control that 911 isn't just going to show up every time you have an alert. Another great thing is you might have a bad batch in your building, or you're single staffed and staff are walking around the building. Of course, they're not going to have the tablet on them. So any alert that happens, it's going to come to this cell phone so they can see at all times if an alert's happening. And if there's multiple, they're going to get the multiple alerts on that phone.
Okay. And I just also wanted to mention, you'll see here, once you clear an alert, it takes you to a page where you can add in information about that alert. So you can choose the outcome, if it was a false alarm, if it was an overdose, if it was some other emergency, you can add any notes. And this will be a place where other staff members will be able to see what happened on the staff the shift before. They'll be able to know who they might need to keep an eye on, who they might need to check on. And it's just another communication tool for your staff, as well as it helps our team make sure that the device is working properly and that there are that we can report back the data for you guys as well. One other thing I wanted to mention, as well as the text message on the staff phone, you can also receive phone calls. I didn't have ours set up just because there'd be a lot going on, but so staff members can also receive a phone call, which will tell them the room number in which the alert is, as well as the time that it occurred, so that they can respond accordingly.
One of the other applications, same setup, but one of the other applications that we have, which we had the steering committee meeting this morning in Philadelphia, is they have a very scattered fleet of apartments or houses. So they have one central place where the panel or the tablet is set up, and they have multiple homes and apartments scattered across the city. So what it does, it just kind of gets into the versatility of how this product can work. It doesn't have to be limited to one building. Alerts can come into one central place from all over. So again, depending on how you set up all of your buildings and how you set up sometimes scattered homes, we can work in lots of different types of environments. One thing as well, I just wanted to mention that it's more for the rural territories and the people that are in the interior. we have a very specific program with rural territory. So what we do is we involve community, and what we do is we train community to be the emergency services responders. And with that, of course, the EMS call can go out, but because of the rule, sometimes it takes 30, 40, 50 an hour to get an emergency responder to the client. So instead of doing that, we will, as in coordination with that, we also train community to be the first responders, which in this situation, most of the time is the building managers. So again, we are trained and installed and understand not only city but rural.
I guess, are there any questions while we have this kind of demo view set up, or anything that people would like to see in more detail?
Oh, it's a live group.
All right, onward.
We have a question that came in through private chat.
Okay.
For the staff phone, does it, sorry, just reading to make sure I understand. Is it only compatible with smartphones? Like if you have staff that have flip or analog or?
Yeah, so it's any phone. We've made it specifically so it can be any phone. A lot of the phones we do see for front desk cell phones are flip phones, or old Nokias or something.
Yeah.
So you can receive text messages and calls on those, and you can also receive calls on landlines. So if you have a front desk landline that you would like as a backup, then you can receive it there.
If there's no answer on a staff phone, will 911? Yes.
Yes, they will.
Yes. So Jason, as soon as it goes from the device to the tablet, it goes to 911, and then 911 calls back. So the whole intended purpose of 911 calling back is to confirm whether or not they need us. If you don't answer, then 911's coming.
One of the things, think about that as just a regular 911 call. And I think a lot of us heard those tales where if you phone 911 and if there's no answer, or if you hang up, you will get emergency responder or somebody to show up. One thing we want to make very clear is this goes directly to EMS. It doesn't go to our partners at ECOM where it's police ambulance fire. So there is no police involvement at all unless there's violence involved, and then that's EMS's responsibility to make sure that they get there. So again, learn from experience. The police are not at all notified unless, again, it's a situation where there might be some violence. Any more questions on that?
And just to clarify, you have the ability to deactivate the 911. If you're an organization that you feel that that's going to bring more trauma, you can have it just go directly to staff, and we can add as many staff members as you want, and disable the 911 piece. So you don't have to have it if you feel like that's not in alignment with your organization's values.
Awesome. Then I will switch our screen back over and start sharing the presentation again. We'll start going through that. Can you guys see my screen all right?
Can you see the screen?
Everybody, yeah.
Everybody, anyone?
Yeah,
Not?
it's just
Okay.
on presenter view still.
Thank you.
Thank you.
Yeah, no worries.
All right.
Okay, so this is one of the things we're most proud of, and the reason for it is that this program, the hardware obviously is really important, and we have 3 different features that we've implemented onto the hardware. But let's all be very clear that, of course, this program doesn't work if people don't use it. And we found very, very early on that the first thing we need to do is to gain trust. And how do we do that? So I want to go through some of the support things that we do for you guys. And this is for everybody. We don't just do it for this program. It's for all of our programs. This is Lifeguard's support for every program that we offer. First of all, on pre-deployment, we do site visits. So we will come, we will talk to staff, we'll introduce ourselves to some of the clients. We talk about what's going to happen. We get people to understand what's going to be going over the next couple of months. So we interact with staff, we interact with clients at that time. We come into the buildings, we test for signal. We make sure that if signals are weak in any part of the buildings, we will then add boosters if we have to. We'll do whatever we need to do to make sure that the signal is strong. I will also share with you that, again, back in the original trial with the cell phones, we were connecting off of Wi-Fi. And one of the things that we found, and I'm sure you most of you will agree, that trying to keep the people using the devices off of the network that you guys operate off. So what we did, instead of having this operate off Wi-Fi, we use cellular technology. So that, again, that data program is included in our support. That's not an extra charge. So we will do the walkthrough there. We start to customize the application. And one of the things we should have mentioned when we did the live demo, this product can be customized to each different location of installation. And when I say that, as Jamie mentioned, we can turn 911 on and off. We can have different people that are going to get the calls. So it's really very specific to where we are installing. Deployment.
Sorry to interrupt.
Sorry
To interrupt. The slides are still on the presenter view, so we see like the black screen around. If you just, it's really small. Sorry.
You.
No worries. Didn't mean to interrupt.
Oh, that's great. Is that better, Courtney?
Not yet. No.
No. Okay.
Please hold.
All good.
Let me stop sharing that. Display.
I can.
There we go. Perfect.
That's perfect.
Okay,
Thank you.
Yeah, there we go. I need something to go by. So again, getting back to installation and implementation. So we do all the groundwork. And before we even actually bring a unit to a location, we would have done things like train staff, gone over with staff the program. We would have started to train and to get involved with a lot of the different people in the buildings. One of the things we do, and we've been very successful with utilizing people that have experience. So we actually will choose champions with your help to pick some people with experience out of the buildings. We'd like to do a rotation so that other people can also get a chance to help if they want to. And at this point too, we then start to roll out things like collateral, and we're going to talk about that in a minute. So we start applying our marketing. We start doing things like putting up posters, handing out flyers, doing one-on-one donuts and pizza meetings with some of the people and participants, so that we can start doing trial and get a lot of buzz going in the buildings before we even get there. Let's find out what the problems are before we even get there and start to address those. So beyond that, our monthly maintenance and support. So we have a 24/7 info line, technical support, service support. The info line, though, is one that we didn't realize the impact it was going to have when we first started. It seems very simple, but in actual fact, the majority of the features we have added into this product and our other products have all come from people using it and put different comments onto our info line. So we monitor all of this 24/7, 365. If there's any problems, we will find out first. We remotely can figure out whether or not it's been unplugged, if it's offline. And most of the time, if not all, we know before anybody else that there's a problem with the device. If there's overuse of it, meaning that people are abusing the use of it, we then will contact front desk. And I don't mean because they're using so much. We do have a couple instances where people have just pressed the button just because. So we monitor and we work with people and staff to make sure that those things are being, it's possible that we didn't educate properly. So we'll go back to the drawing board and try to come up with a game plan. But again, this is all together. We don't do this, or we don't phone you guys and say, you got a problem, please, this is where it is, and go deal with it. This is a partnership. And one of the things that we do at the very beginning is with each different association or group, We then established at the very beginning what we call a steering committee. I like to refer to it as a board of directors only because it really is the governing body, very informal, of how all these projects from the implementation, actually even before implementation, during implementation, and then all the time after that, this group of people will meet on a monthly basis and then quarterly to figure out and find out what's the best way to roll this out. What buildings do we want to do first? Which people do we think are going to be possibly challenges? And we start to look into that and really come up with a custom game plan for the rollout. Beyond that, our friend here is very much, Amanda is very much up on the fact that, and she's trained to do monthly support in that she will give you guys a call and communicate with you on a monthly basis to touch point, find out if there's any concerns, anything we need to address. Then on a quarterly basis, she will again phone you guys, touch base, review data reports, get back and make sure that our game plan that we established in the steering committee, we're on track, we're doing the things we need to do. If our initiatives are not being met, we will then go back to the steering committee and we'll reestablish new initiatives and we'll refocus on what we need to do for the next quarter. The important thing is here is we drive these results through our anonymous data. So as everybody knows, data is what the world lives on today to make educated decisions, but we use data that doesn't have anybody's personal information. Things like time, like type of drug, things that are going to help us to gauge where we're going to go with the project. I would say building by building, if you will, as opposed to room by room. We have support where we, again, training ongoing before, during, and after. So we will show up again at the beginning. We'll go through all the training. Each room gets a check mark to make sure that that client, that tenant has been trained. If they aren't there at the original one, we then come back and we do another walk through the building and make sure that everybody's trained. If there are new tenants, Amanda's job is to then set up appointments, do it through Zoom, play videos, one-on-one. We'll get everybody trained up again. New staff, same way. We'll make sure that we come back, we make sure that everybody's trained, and that is all part of our support program. That has got no extra cost to it. We're there to help. We're there to figure out what is working, what's not, and we'll make changes as we go. Any questions on that?
There's one question in the chat. Is there any hardwiring needed for installation?
Sorry, absolutely not. And anything like that to do, we do everything. If there was something that we had to do in regards to a wiring, which there's not, we would bring in our own electrician. But we do not. It's plug and play. It's extremely easy to put in. It's affixed to the wall with special adhesive tape. We've also got little screw holes that we can use if that's not going to work, or we need both. So it's extremely easy to install, but we do the install, not you guys. We do it for you guys. We do the hookup with 911. We do the run through, make sure it's working, get everybody involved. That's our job. And we give you the reports back so you see to make sure that we've done it. Next, Alex. So this is some of the, we're going to just review some of the marketing materials and some of the data reports that we show you guys. So here's one that we provide, but how do you get access to this? And this is maybe where we should have started. Everybody that's got a Lifeguard Light agreement has a customized access portal on our website. So we'll use Phoenix because we keep talking about them, but Phoenix or Pearsonville or Atira, they would have their own private customized place to go on the website, where this would then be able for you guys to download, and would also have your logo on it if you want. So this would actually be your own collateral in line with Lifeguard. So it isn't just ours. Again, we're trying to get this team environment together where each location and company is part of this with us. It isn't just Lifeguard. This is one example. We go to the next one. This is a brochure that we developed for handouts. Whether it goes to staff, people, clients. And one other thing, just before next one off, and I apologize. I know this isn't very, it's hard to see, but we developed a couple of new ones, a little bit more, I know it's tough to see you guys, but a little bit more
Geared to residents.
geared towards residents. So a little bit more, the artwork is a little different, of course, because the audience is quite different. But again, we change these on a quarterly basis. So you'll have different themes. You'll have different themes on what you're going to see next in our social media, which we again put out at no cost to you guys. So we're very involved in different ways to make this product aware, or people aware of it in the buildings, clients, and staff. How would you want to explain this one, Alex? The how you guys built
For
this
sure.
and set it up?
Yeah, so this is example of what your customized admin portal that Jeff was talking about might look like. And so this is the data portion. So at any point in time, if you want to log in, see how your building or your organization, how the devices are being used, any information about them, you can come here. And so as you can see, you can select from any date range, and you can select any building that might be in your organization. Obviously, these ones are from but yeah, a bunch of different organizations. You would only be able to see your own, but you can select them and be able to customize what data you want to see. Once you do select, you'll be able to see the number of alerts, the number of sessions. So a session is somebody using the device. It doesn't necessarily mean that there was an overdose or event. You can also see the starts and extends, so you get an idea of how people are using the device, as well as if there were any errors during that time period that you've chosen.
Also, you can just see whether they're using it, the period.
You can see which ones are active and which ones aren't when you log in.
Right.
Yeah, and then one of the most exciting things is the temperature sensor that we talked about briefly in that video. So just below that, you can see every room in the building that you selected. You can see the max temperature, the minimum temperature for every day over that time period to start to give you a picture of what rooms might need more attention as far as heating or cooling. You can take this information to potential funders in order to kind of plead your case on why you need that or how bad it is in your building. And it's just a really good touch point for residents as well. So this is in addition to the high temperature alert. You can also see all that data historically as well.
So I'm just going to say it anyway, but I think most people understand why we included the room temperature alert, especially in a lot of the older buildings. And up there you can see Rainier, which is an older building as an example. The ventilation is, in a lot of times, it's horrible. Who's ever giving the buildings or sponsoring the buildings, we all know how tight money is. Usually they'll get the building and they'll refurbish it to some degree. But a lot of the times these older ones don't get proper ventilation. And we all know, especially during spring, late spring and summer, the temperature rises. And as people are using, the vulnerability of getting heat exhaustion or even passing away from it increases dramatically. Not equivalent to the overdose deaths, but it does go up there in the summertime. And I think we all know that. So that's one of the reasons why we included that. And as Alex said, we've had a few people use these reports. Hopefully BC Housing gets in on this, because you guys can use this to go to BC Housing and say, or whoever, that we need to get some money because we need to fix this in the building. So we see it from both sides. We're trying to help you guys in saving lives, but also in operation, and provide the best data we can for you to make good decisions.
Just before we move on, are there any questions about the data reports or any of that information? Perfect.
So this is just a sample of something we did social media in Ontario, but we just as an example, again with help from Amanda's help, and with different inputs from different clients. Every week, actually, we will post a new post, and they all are relevant to the challenges and good and bad things and that we all experience. So it's very in tune with the world to which we all serve and live. And again, that's all part of the program. You don't pay any extra for that. please feel free on the info line to pass ideas of things you might want to see on social media posts. But again, we also deal with that on your guys' behalf as well through our program. I'm going to pass that to you, Alex.
All right. And then this is the final, talking about the timeline. So what it looks like for install. Jeff went over previously of all the kind of services on a high level. But here, if we kind of, put numbers to it, our first 1 to 2 weeks, we're normally in planning and designing. So we're going to define that steering committee that Jeff mentioned, or the board of directors for the project. We're going to host a project kickoff, and we really want to define an approach and an overall timeline that we all agree to and we're comfortable with. So we're looking to you guys as the experts on your organization or your building to give us information on how this is going to work best. And then we're going to provide our expertise on how we can make sure that this is as successful as possible. Next.
Let me give you kind of just to give you like in our steering committees, I just want to give you sort of an analogy, if you will. We'll be in a meeting and we'll come up with an idea of how we might install, I'll just use Rainier because we use it. But the people in Rainier might say, you know what, I think we should approach it this way instead of that way. So I just wanted to emphasize in these steering committees, they really are, well, some of our ideas, but really driven by you guys. It's really you guys that explain to us the inner workings of our idea of how we think we should roll out. So again, this board of directors, again, as I call it, they work together. We work together the whole project from post, install, and all the way as long as you guys have the product.
Yeah, exactly. And there can be as much or as little involvement from you guys as you want. If you want us to come in and install, we're happy to do that. But we really love to work with you guys in your organization to make sure that it's as successful as possible. Next, it's going on to building and testing. So we're going to configure the devices for your building, any customization, we'll complete all the testing. Then we're going to move to training is our next step. So we're going to begin the communication in the buildings, train staff, hold those info sessions with pizza or donuts for residents. All that information is going to be disseminated during this time. And then we move to the actual installation. And so our installers are going to come to your building. We are going to install the devices in each room. We're going to sit with the residents, understand where they use in their room, what their habits are, so we can customize it for them. And then we're also going to train your staff on site, provide you guys with a lot of information to make sure that it's up and running, and complete all the BC emergency health services testing, all of that sort of stuff. Then our final step is kind of stabilization and monitoring. So once we have everything up and running, we're going to continue to check in with you guys. We're going to provide the data reports, check in with you on any feedback you might get from residents or from staff on how we might be able to make improvements. We're going to check in with the steering committee on a continual basis to really monitor how the program is going. And you guys always have our 24/7 helpline and support staff to work with you on any problems you might encounter. So yeah, I think that kind of gives an overview of what the timeline looks like. Typically, it's about 12 weeks, but that really depends on each building and each organization, from everything from the number of devices to how in depth we want to go in some of this preparation. Any questions there? All right, then I think the last one is just a video.
I'm gonna just share a couple of facts with you guys. I just want to talk a little bit about the current projects we have to go, and then some fun facts about Lifeguard and some things that have happened to it. But a couple of projects that we have on the go right now. If some of you aren't familiar with SUAP, Substance Use and Addictions Program out of Health Canada, we are proud to say we've been awarded 3 SUAP contracts. One we're in the midst right now of rolling out with Portland Housing. But we are in the middle of 2 other ones that are a bit revolutionary and game changers. And the first one is we are working with Ministry of BC Corrections, Connective, as well as Federal Corrections, and we're building a post-incarceration app. So with our Lifeguard application, we are now developing connections and services for literally people the second they walk out of jail. And we are extremely proud of that. And we, with Health Canada's help, we're going to be at the point where we're going to actually start to change policy. So we're extremely proud of that. The second project we have right now in relation to what we have here, it's a project and a product that Alex and his company had started before Lifeguard, but has brought it in. And one of the reasons why I was so excited to have Owen and Alex join our team is that we are developing through this program at SFU a very, very low cost wearable. That wearable will, there's an algorithm being developed through vital signs that will predict and will monitor for drug overdose or crisis. So again, we're trying to develop a low cost device that can be, again, not something that we resell or anybody resell outside of the building. So they've got their inside piece. What do they do when they leave the building? We are right now trying and working very hard to develop that product. And hopefully in the next year or so, we're going to have something that we can roll out to the community. We are also adding to the program that we already have with BC CDC, which is a manual drug alert program. Right now, all the health authorities, a lot of us know that they send out health authorities by SMS and I think email out. Am I right? Yeah. Some. And at that time, what they do is they push those alerts to Lifeguard, and we push them out through the app. But we're also going to start pushing them out into the tablets. So what will happen is, even though each room won't know about drug alerts, the front desk will know about drug alerts, and will be able to then warn, notify clients in and out that there could be a drug alert. There also could be one in the building. So again, if there is, Lifeguard Light will, again, if it gets so many alerts at a certain amount of time, it then actually sends an alert for an evacuation alert, or so everybody realizes that inside the building there's something going on. The second part to that BCCD relationship is we're building this into an automated system. So rather than there being any human intervention, drug alerts will be posted via all the different platforms: WhatsApp, Instagram, TikTok, all the different ways, SMS, email. These things will be now automatically uploaded through all the Lifeguard connections, including SROs and the tablets. Currently, we have another program with BC CDC where we have this card here. I know it's pretty tough to see, little thing, but it's got a QR code at the top. And those are going to be very soon. When you open up a Narcan kit, you're going to see those cards that are in the kit. And it scans you right to Lifeguard where our app is, and you can download the app automatically. We are also working on a system with a different CDC to have a Narcan program that will upload data from Narcan use. So that's a whole different other project, but I just want everybody to know where Lifeguard isn't just about supplying our products. Behind the scenes, we are working on a lot of different things to support these and understand where we're going to go with our support and our products. And it isn't just Lifeguard Light, Lifeguard you see now. We've got many more things coming down the pipeline. One of the other ones, and I'm maybe going to let Shundan speak a little bit to this, is it's important to just briefly touch on privacy and security. Even though we're only going to touch on it, that does not mean that its importance isn't at the top of the whole thing that we talk about. So we are completely compliant in all aspects of our products, but we've taken this a little bit further, well, a lot further. Being a small company and being the clientele that we serve, highly scrutinized in terms of how we manage even our anonymous data. So with Chana's experience and background, she and her team started to build out our very own specific blockchain, which we call LifeSecure. And it's a tunnel, if you will, that protects information traveling from one device to another. And to her credit, she's the UN delegate for Australia Public Health. And she has presented this and that system 2 times in the UN. And they have also tried it, and it's moved from there to an actual live trial. you want to mention anything, Chandana? And just briefly on that, I think it's important.
Okay, thank you, Jeff. As Jeff has pointed out, we are very particular about not only compliance, but also make sure that our technology actually works. It means that we started off building the trust with not retaining any data on our app. The minute anything leaves our devices to a 911 call, everything is deleted automatically, so nothing gets retained. That's where we started off. And then we realized that there is a requirement to build when it leaves our devices or apps or anything that relates to Lifeguard to 911, there is that communication that during the way that the transit of the data, that's where it can be intercepted. And we found a solution over 2-3 years in development, which is now called LifeSecure. It's built on Web3 technologies, which is the latest. And it is almost a device communication. So no identities can be tracked back to any devices. So that's the beauty of the new development, and it's been presented. It's now currently being trialed for Australia, where it's a requirement, as part of the Lifeguard products. So that's where we are. Very excited. Right. Thank you.
Thanks, Chandana. I appreciate that. We don't have much time. A couple of fun facts. So Lifeguard, we presented in the White House. We did that in 2018. Chandana has been to the UN many times to present our products. I believe that our pitch deck for Lifeguard was on the website for the UN. As Chandana said, we've opened up in Australia, and kind of a unique comment is that we've also got a trial working in India. So we are expanding and using our trial to learn about different communities, different environments, what it's like in different countries and continents in terms of how to deal with the drug usages and how to promote harm reduction and how to get what we do in Canada and get those messages across and learn more and more and more. So I'm going to stop talking because I could probably go on for more hours. We're going to play this last video and then
I think Courtney.
Oh, Courtney.
Sorry, I'm just cognizant of time. We're almost 10 minutes over the scheduled. It was just, that's okay. It was just scheduled from 1 till 2, and so I want to make sure that people have questions or time to ask questions before they have to jot off to other meetings and things. And we also have Danielle in the room from one of the housing providers who's using Lifeguard, who is here to answer any questions from that perspective as well, if folks have them. Don't mean to interrupt you, Lifeguard, but I just want to be respectful. Okay, perfect. We love a very full presentation. It was awesome. So there was one question for the Lifeguard team before I ask a couple questions of Danielle, and if folks have to leave, please mind your calendars. Let me just scroll through the chat. Where did it go? There was a question as what is the cost of installing this in buildings from Lifeguard?
Well, it's free under this program, isn't
it?
And you know what? That it ranges depending on volume. So it ranges anywhere from $350 if you're just buying a few, up to volume about $300 per device, and then the cost for support, depending again on volume, is $9.95 to $8.50.
I'm just going to jump in there for the cost. This, because this is a different program and it's coming from as a funding from BC Housing, the cost will be a little bit different for these devices as well, and we're working out those details. But just to let you know, this is going to include installation and associated services and operations for about 3 years period, because we're very well aware that nonprofit housing providers having just the installation and trying to budget in the operational cost is always a bit of a stretch. So these 3 years, the period of 3 years, we're hoping gives providers sufficient time to bake in the cost of what it would take to operate those devices after that. But we'll definitely release more information on what the costing of these devices will be early in the new year. And it's going to be different just given the program. It'll be better for sure, yeah.
Awesome, thanks, Shruti.
Oh.
I think I can answer the next one as well, Courtney, quickly.
Mhm.
So the grant call, we'll release the information about the funding in probably the second week of January, but we haven't figured out the exact date for the release, but it's definitely going to be in January 2024. We've only recently received some of the information to finalize this project, so we'll definitely keep you in the loop. Second or third week of January, we'll have a lot of communication going out to all of you. So just keep an eye out for a BC and BHA communication about this funding program.
Awesome. And then we also have Danielle Elkerton in the virtual room with us. Just one question for you, and then we'll open it up to the rest of the room as well. Can you just share a little bit of your experience of using Lifeguard's technology devices in your buildings?
Yeah, absolutely. Thank you for having me. I'm actually also joined by my colleague Ayu,
perfect.
who is the assistant manager of the program. I'm a senior manager with Community Builders. And so we're just going to sort of maybe give you a bit of a rundown of what our program is. So we're running some overdose prevention beds out of one of our sites. So they're overseen by the overdose outreach team. And the idea behind the beds is that folks have had a recent overdose and now are trying to stabilize on OATs. So we went through the process of installing Lifeguard in July of 2023. Have to say across the board, like very, very easy installation process. And the actual building that we're talking about is an older building. And the installation process went well. I do have to say we actually haven't had a call escalate to 911 at our program since July. So, you know, I think that's exciting in and of itself, just in terms of folks. Ideally, the program as a whole is working quite well and serving folks as needed. And Ayu, maybe you want to touch on a little bit of training. I know both Ayu and I have to get out of here for 2:30, so I just maybe want to quickly cover what it's all about, and then we can open it up to any specific questions.
Yeah, adding on to Danny's, the training for tenants and staff is not, we didn't find it hard. We don't have permanent residents there. They just come over for 14-day stay. And training them is as simple as training the staff, because it doesn't have complicated steps on how to use it. And we didn't find it hard for tenants to know how to use it. And same goes for staff. Staff assigned to work on the OOT wings, we train them ahead of time. Orientation. Usually our coordinators do things for all our tenants and our staff. Yeah.
Thanks, Ayu. Yeah, I think it's just created like a real peace of mind for the staff team, especially on minimally staffed shifts where, you know, a lot can happen in a building in a very short period of time. And it certainly promoted the autonomy of the residents staying there, as with a 14-day stay can be really challenging, kind of destabilizing for folks to be coming off the street and only be in a place for 14 days. And so giving folks as much privacy and autonomy as possible has been kind of paramount for us. And Lifeguard has certainly allowed that to happen. So yeah, couldn't be more positive about it.
Thank you.
So we love to hear. Do folks have any questions for either Danny or Ayu or any of the Lifeguard group?
Must have covered it so well.
Nailed it.
There's always that pause as people typing, right? So
Yeah,
Right.
true.
Yeah.
We do have that last video if you want to play quick. We have a last 1-minute video if you guys want to see it. It was,
Actually with Julie speaking. I know she wasn't able to be here today from Community Builders, but it was a piece that she and I did together and she was so amazing.
awesome.
Yeah. Okay, if there's no more questions, I'm gonna hop off. Thank you, everyone. Thanks for the
you, Danielle.
invitation.
Thanks so much for joining
Thanks,
us,
everyone.
Danielle.
Really appreciate it.
Yeah, I'll just play this last video and let it kind of speak for itself.
A BC-made harm reduction tool aimed at preventing overdose deaths is being installed in more than 2,000 SROs and supportive housing units across the province. We got a look at how the device works and why it's so vital. With a click of a button, this device could save lives.
I'm gonna use my substance, and so I press start.
It's called Lifeguard Lite, an innovative new tool that allows residents living in SROs or social housing to set a timer before using illicit drugs alone in their room. Once the countdown is complete, residents hit "I'm okay," but if that button isn't pressed in time, an alert will be sent to building staff and 911.
These people are getting help immediately.
Sinclair says as a former drug user and SRO manager, she knows the benefits of a device like this. She remembers what she calls a traumatic day in 2021 when she went to check on a resident named Joy Phelps, knocked on her door, and no one answered.
I believe 10,000% that if Joy would have had this in her room, she wouldn't have died.
Data from the BC Coroner Service shows more than 12,000 people have been killed by toxic drugs since 2016, many of them dying inside shelters, SROs, hotels, or supportive housing. 61% of people who died during the pandemic were using alone.
Often people, even if they have a safe consumption site to use a substance, want to be alone in their room, and there's privacy and there's safety.
Her organization runs 14 supportive housing buildings in Vancouver. She says there is at least one overdose death per month.
The overdose crisis has taken a truly enormous toll.
Lifeguard first developed a similar phone app in 2020. Since then, 69 lives have been saved through the program. But not everyone who lives here has a phone, which is why these wall-mounted devices are so critical.
We're saving people's lives, and it's peace of mind for staff and residents.
Right now, devices are being installed at Vancouver's Portland Hotel, on Vancouver Island, and in the interior. The province says it is aware of the Lifeguard Lite device, but did not say whether it plans to pay to install them in all public housing units. Sinclair says with the unregulated drug supply becoming increasingly more toxic and unpredictable, devices are needed in every unit across the province.
Every time that button's pressed and someone doesn't die, that's a family member who doesn't have to get that phone call. That's a staff member who doesn't have to stand at that door and, call the coroner.
The Vancouver
So that's it for us, you guys. We want to say thank you so much and appreciate everybody taking time out of their day to listen to what we have to say. And I think we should congratulate all of us for making an effort to save lives. We all appreciate and understand and know what we're up against here, and we're really proud of what we've accomplished and what we're trying to do, and we'd love to work with you guys and try to save lives in your buildings. Actually, I'll say we will save lives in your buildings, because that business model has already been set. So looking forward to it. And if you guys have any questions, concerns, want any information, feel free to reach out to any of us. We'd be more than happy to get back to you guys.
Thanks very much. We will linger and be the last ones to leave if there's other questions or folks from the group.
Thanks,
Right.
Alicia.